Welcome back to Wake Up Wenatchee Valley. Again, I'm Steve Hare, your guest host this week, sitting in for Dan Koontz, who's on assignment, and he'll be joining us again next Monday. For now, thanks for joining us here on the program. Time is 31 minutes after the hour. It's time for our live interview segment of Wake Up Wenatchee Valley, and our topic today has to do with a scourge that really is a plague across the United States right now, and that's the abuse of prescription drugs or prescription painkillers, leading sometimes to opiate abuse and addiction. Joining us from Confluence Health today, we have Dr. Peter Rutherford and Glenn Adams. We're going to be talking about what the hospitals are doing to stem the tide of drug abuse, and what types of things that you're doing both in terms of helping people dispose of the old drugs, but also how you're working with your doctors and patients to maybe educate them better about this real problem. Again, thanks for joining us, gentlemen.
Thank you.
First of all, let's start with you, Dr. Rutherford. Obviously, this is something that you've been tracking for quite some time, but just how prevalent is the problem of drug abuse here in the Wenatchee Valley, at least from your experience?
Well, I think we've seen over the last several years really an increase in the use of opioid prescription medications as well as other narcotics like heroin. And some of that really got started, I think, a few years ago with a real effort to look at how much pain people were having in healthcare from surgeries and injuries and how we were going to reduce that. There was an effort around looking to see how much measure more objectively with scales how much pain people were having, and some regulatory and accreditation pressure around making sure that that was well controlled. And in some ways we got to a point where pain levels in the hospital were looked at as what was called the fifth vital sign. Okay. So you were looking at pulse rates, blood pressures, temperature, oxygen levels, and pain. And it really raised this awareness, and everybody started making more effort to reduce the amount of pain that people were having throughout healthcare.
Well, pain management is a tricky thing to treat, isn't it? I mean, it's a difficult thing to treat. Without, people with chronic pain, it's very easy to become addicted to these types of medications.
Yeah, the real dilemma, and I think what's been then determined over the ensuing time as we've had more experience with higher use, is that if people have chronic pain, have an acute injury and receive narcotic pain medications, that if they stay on those medications longer than about a week or 10 days continuously, that the risk of chronic dependency goes way up.
Interesting, very interesting. Now, Glenn, from your role at the hospital, what is your role in all of this?
My role really is around a committee that we put together about 5 months ago to start addressing how we are going to respond to this opioid epidemic. And it's a huge project that spans how physicians prescribe medications to, once we get medications in patients' hands, what do we do with that? How do we get them disposed of properly? And people know what to do with their medications.
Well, I know that Confluence Health just recently has implemented a new disposal actually sites that you can actually get rid of these pills in a safe way. We have.
About a little over a week ago, the DEA put on a National Drug Take-Back Day. And about 5 years ago, I think Dr. Rutherford and I started down this path of trying to get disposal sites in Confluence Health. And we just finally achieved that goal. And we have one at Wenatchee Valley Hospital, one at Central Washington Hospital, and then we partnered with Laketown Pharmacy in Moses Lake to put in a third disposal site.
Are you seeing any, what kind of response are you seeing so far?
It's been pretty phenomenal. The first weekend that we put these out and had patients dispose of their meds, we filled up both containers here in Wenatchee.
Wow.
it's about 35 gallons per container.
Wow.
And by Monday morning, they were full.
Oh my goodness. Well, that's prolific.
Yeah.
When you think about it, and it's also kind of concerning
It
too
is.
to think that there's that many drugs out there.
Well, and these containers are great because we can have any medications, prescription medications, over-the-counter medications. And what took us so long was our ability to be able to take back prescription pain medicines.
Yeah. Good idea. If it's not prescribed for a particular ailment or a pain that you have, get rid of them. Don't let them fall into someone else's hands. I know that at my house, maybe you went to the dentist and he gave you a prescription for some OxyContin or something, or a codeine. It sits there in your bathroom drawer. And certainly anybody could get to it. So better off just to get rid of it, correct?
Very much so. I think that what we see is the rate of narcotic overdose deaths accidentally in this state is now approaching that of, or surpassing that of, automobile accidents.
Oh, goodness. And now I would imagine that you're also seeing at the hospital, because I know law enforcement is seeing this, a lot of overdosing that's going on right now, not just with prescription drugs, but with the opiate heroin as well.
Yes, the number of people coming in with overdoses is higher. What we've seen with the tightening and efforts that we've recognized we needed to do something about the prescribing of narcotics is that as that amount of prescription has gone down, the use of heroin has gone up. And we are now seeing with the heroin that it is being mixed with other narcotics, including fentanyl, which is less expensive to procure than heroin, and ends up with a much more difficult for people to know the potency of what they're buying, and so then the overdose levels or risks go up even higher.
My goodness. Well, I've heard it said by some law enforcement, drug task force people, that the opiates now are a bigger problem, let's say, than what methamphetamine was a few years ago. Is that an accurate assessment?
I think we're seeing more and more of it, yes.
So how are you working with your doctors on prescribing pain meds?
You want to go ahead? Sure.
Go
So
ahead.
part of our committee that's looking at the opioid epidemic, we've started to work with the doctors on prescribing activities around acute pain. So after an injury or a surgery, do we need to prescribe as many pain medications? And then we're trying to come up with a more organized approach to helping manage our patients with chronic pain who are using chronic pain medications, chronic opioids, and trying to come up with different ways to manage those patients on lower doses of opioids.
Is there anything on the research end of things that deals with pain management and pain medication? Is there any research that's being done to find some kind of a pain medication that is not as habit-forming or addicting?
Yes, there are people trying, and I mean a number of studies and things looking at what are non-narcotic options for pain control. But I think one of the things that we really need to talk about as a community, as a healthcare system, is what are expectations around pain. If we take a look at, a common one are things like joint replacements. And we know that having your knee replaced is going to hurt. And we need to have that message and that discussion up front so that people don't have an expectation that they're not going to hurt at all, but that they know that the first couple of days are the worst, similar to when you have a broken arm. But then, and that's the body really just telling you, don't move this thing for a while and let's let it heal.
Right.
But then we know that at the third day, the fourth day, the fifth day, the swelling goes down, the pain will decrease, similar to an abdominal surgery. It's going to hurt to cut the muscles to get inside the abdomen, but that pain does go down as the body heals over a few days.
Okay. Now, for the general aches and pains that we feel after skiing or hiking or biking or whatever, what's the best way of treating that? I mean, people like myself who had 2 hip replacements and a broken hip on the other side, I mean, I'm living on ibuprofen, you know, basically. You get up in the morning, you take your anti-inflammatory. Is that the best course of action for someone like that?
So many of those medications like ibuprofen or Aleve or naproxen can really be very effective for a lot of chronic pain type things with inflammation. And they are really relatively safe. They are non-dependency forming, and if used at appropriate doses, have really very little risk of kidney injury or stomach distress or whatever.
Okay, but are there things that we should watch out for? Maybe the overuse of that type of anti-inflammatory?
Yeah, the rule of twice as much is twice as good, there is a top, and where you get no more therapeutic benefit, but significantly more side effect risk.
Are there kidney implications here with the use of that type of medication?
In people with certain types of underlying kidney issues, if you take too much, there is a risk of kidney damage. But at the prescribed doses and the over-the-counter doses, that risk is really relatively small.
Okay. We're talking today from Confluence Health. We have Glenn Adams and Dr. Peter Rutherford. We'll be back with more. But first of all, I wanted to share with you a little public service announcement that's been put out to fight this scourge of opiate and prescription drug abuse.
Each year, more people die from prescription drug overdoses than from car accidents. Abuse of prescription drugs is a national epidemic and can lead to addiction, overdose, and even death. Did you know many teens get their drugs for free from their family and friends' medicine cabinets? They think prescription drugs give them a safe high. Protect your family and loved ones. Secure and monitor prescription drugs and dispose of unused or expired drugs. Start by counting your pills. Then, get them out of your easily accessible medicine cabinet and lock them up. Keep track of your family's refills because needing refills more often than expected could indicate a problem. If your teen has been prescribed a drug, control the medication and monitor the doses and refills. Spread the word to family and friends. Learn more at pharmacy.ca.gov.
We're back on Wake Up Wenatchee Valley program. I'm Steve Hare, sitting in for Dan Kuntz. My guests in studio right now are Dr. Peter Rutherford and Glenn Adams from Confluence Health. We're talking about prescription drug abuse and what the hospital is doing to make it easier for you to dispose of those dangerous drugs without having them getting into the wrong hands. Time right now, 44 after the hour. We'll be right back with more with our guests. You're listening to Wake Up Wenatchee Valley.
Trade Dollar Coins, Wenatchee's premier coin shop. Coins, currency, gold, silver. Whether they're your passion or your treasure, you'll find what you're looking for. From coin enthusiasts to avid collectors, find coins rarely seen from around the world. Whether you're buying or selling or just need supplies, Trade Dollar Coins is the place to be. Come see for yourself. Trade Dollar Coins, located on 5th and Wenatchee Avenue.
Kubota's Orange Opportunity Sales event is going on now at your local Kubota dealer. Take command of your lawn care needs with a new Commander zero-turn mower. Get commercial-grade performance and a full 4-year factory warranty at a price you can afford. Now get special promotional pricing of $38.99 with 0 down and 0% financing for up to 48 months. See your local Kubota dealer today.
Their Kubota dealer in North Central Washington is Valley Tractor and Equipment in the Baker Flats Industrial Park, East Wenatchee. Weeds Cafe in Cashmere offers the perfect setting to relax. Grab a cup of coffee, a latte, a mocha, or a snack and kick off your day. Or come in for lunch and have a sandwich, salad, cup of soup, and a beverage. Conveniently located in the center of Cashmere on Cottage Avenue, Weeds Cafe is open 7 days a week from early in the morning until late in the afternoon. Meet a friend, have a meeting, or maybe just sneak away for a quick bite or drink. When in Cashmere, do what the locals do and make a point to say hi to the friendly staff at Weeds Cafe. It's time to celebrate your mom. Head on over to Wenatchee Valley Mall where you'll find a great gift for any type of mom.
I have a glamour mom. She loves the frills.
My mom's down to earth. She loves to chill.
My mom likes to relax all day.
My mom could buck a bale of hay.
Wenatchee Valley Mall has something for your mom. You can even win a surprise package for mom just by entering the Best Mom Ever contest. Visit the customer service booth or get details online.
Welcome back to Wake Up Wenatchee Valley, and I'm Steve Hare, your guest host for this week. I'm joined in studio right now by Glenn Adams and Dr. Peter Rutherford with Confluence Health. Our topic this morning is prescription drug abuse. It's a community-wide effort, obviously. This is not just Confluence Health that's concerned about this ongoing problem and plague, you might even call it. But again, it's community-wide, correct, Doctor?
Yeah, there's been a lot of community effort on healthcare from the healthcare side. We've done a lot and have had there's really been, I think, some very good leadership from the folks at Columbia Valley Community Health as well, and the folks in Leavenworth and in Chelan. This is a regional problem.
Are you doing any kind of an outreach, like to the schools and other groups, to make them aware of the problem? Glenn?
We have not started. That's part of our plan in our committee that's looking at this. First, we thought we needed to start in our own house a little bit, and then after that, after we have a really good plan in place, then we're going to reach out to the community. We want to work with the sheriff's office. We want to work with the schools and just get this message out.
Fantastic. So again, Confluence Health through the Wenatchee Valley Hospital and Central Washington Hospital has that information for you, and their disposal sites are at both hospitals plus the, the pharmacy in Moses Lake?
Yep, Laketown Pharmacy in Moses Lake.
Laketown Pharmacy Lake. Make use of that, folks. It's really critically important. Let's talk about the state and what its role is in all of this. Dr. Rutherford?
So one of the things that the state legislature did several years ago was start what's called prescription monitoring program. And so as any healthcare professional can get an account and log into that, and it is a database of all controlled substance prescriptions that are made by any individual, by any prescriber, filled by any pharmacy within the state by patient name. Because one of the problems that we were seeing in this state and also elsewhere in the country was that people would go to, say, the Central Washington Hospital emergency room and have a pain condition and get a pain or prescription for narcotics, and then they might go to Chelan and do the same thing in the emergency room. Then they might go down to Yakima, or they might go to Spokane or to the Tri-Cities. And there was, prior to this database, no good way to be able to track that. But now when people come into the emergency room or into my office and are on chronic narcotics, we look them up in the prescription monitoring database, and we can see how many they had filled, by whom, in which pharmacy, on which date. And so this ability to so-called doctor shop or emergency room shop has been significantly dampened.
Well, it seems like you're constantly in the mode of catch-up. It seems.
Yes.
You know,
Right.
We're always right behind the curve in terms of trying to keep up with the problem. What types of options are out there for treatment?
So there's a number of options. One of them, once someone has an addiction to prescription pain medications, there are a bunch of options. One of them you may have heard is Suboxone. It is a treatment option that helps patients with their addiction in conjunction with their physician and maybe their behavioral health provider. But it is an option to help these patients.
Okay. And one other item that I wanted to talk about has to do with warning signs. What are the warning signs that someone is addicted to prescription painkillers?
Well, I think the first thing that I would say is I think sometimes it's really hard to know. And I think people have a perception that it is certain people in certain socioeconomic or certain economic strata in this state or this country that have this issue, and that's absolutely false. Mm-hmm. It is in all people of all races, all genders, all social statuses, also all educational levels, all economic levels. So it's ubiquitous throughout this country. I think as far as warning signs, I think sometimes the changes are subtle and are really very hard to see, but sometimes we see people being somewhat more withdrawn, reduced work performance, reduced school performance, personality changes, just not caring as much about things that they used to care about. But it's really tough sometimes.
Yeah, it is. And kids, are curious, certainly. My thoughts first turn to the younger kids and the access that they might have to, let's say, what's in the medicine chest at home.
No, and I think that's one of the reasons that we really wanted to get this drug take back, was that we know that many kids, young adults, get started by finding the old narcotics that the parents had and kept stored in the cupboard. And the best way to do that is when you're done needing them for your acute injury is to get them out of the house.
Confluence Health officials join us here on Wake Up Wenatchee Valley program, 52 minutes after the hour right now. I'm Steve Hare. Let's talk a minute about, other methods of pain relief. And I know medical marijuana is being looked at by many as a possible alternative to prescription drug meds. What is the position of Confluence Health, let's say, on the use of medical marijuana?
Well, I think there are a lot of good and reasonable anecdotal type stories out there of people having significant relief with a number of medical conditions from medical marijuana. The dilemma is there are not good trials to know how much of the response is really, for lack of a better word, objectively due to the marijuana, mm-hmm. and how much is from placebo effect. We know from a lot of studies of other medications in the past, including antidepressants and so on, that the placebo effect with these is exceedingly high.
Interesting.
And so trying to ferret that out is
So when you say
important.
placebo effect, for the layperson out there, what does that mean?
So that means that I take this pill and I think it's making me better, so indeed I do get better.
Okay. But it doesn't necessarily have any real
cause and effect.
Okay.
But it may. I don't want to say it isn't there, but I just don't think there is a lot of great objective data out there yet to know where does it fit and in which conditions is it of objective benefit.
More empirical research is needed then.
Exactly.
Understand. Dr. Pete Rutherford and Glenn Adams joining us here today on Wake Up Wenatchee Valley. We want to thank you very much for sharing the information. In fact, I wanted to give you the last word in terms of this particular topic. Is there anything that we've missed that you'd like to get out? Glenn, first you.
Wow. I just appreciate the opportunity. It is a major problem across the country, locally, at the state level, and we just need to educate the public and make sure they know that resources are available if they need it.
Dr. Rutherford?
No, I want to thank you for letting us have this opportunity, because this is something we've got to talk about as a community and as a state, because if we don't, I fear for what comes later. And then I would reiterate, if people have a chronic pain medication or a chronic opioid problem at this point, there are good ways to get people to help them to reduce that utilization so they don't spend the rest of their life or a significant amount of their time on those, and can have a fulfilled life.
Well, fantastic. Well, we appreciate the valuable information that you're sharing with us today. Another healthcare topic, of course, tonight there's going to be a special forum out at the Kashmir Riverside Center. And this forum has to do with healthcare and the Affordable Care Act and what it means to North Central Washington. Dr. Rutherford, you're going to be a part of that panel discussion tonight. Your thoughts, first of all, on ACA? I know it's a huge issue that could take another full hour on, but in terms of what you're seeing in Congress right now and the changes that are occurring, maybe you can give us a snapshot of what your message will be tonight at the meeting.
I think my message is going to be from a Confluence Health perspective that we have seen an increase in access for patients as a result of, or at least temporally associated with the timing of the Affordable Care Act. And I think we hope that we can have a civil and thoughtful discussion in this country about what problem are we really trying to solve and what is the best option at the end of the day to accomplish that.
Interesting. Well, a lot is changing as we speak today. I guess the House has passed its version of a reform bill. That's now in the hands of the Senate, and certainly its future is uncertain. Thank you very much for joining us, gentlemen.
Thank you very much.
And again, if you'd like to learn more about prescription drug abuse and what you can do to stop it, I'm sure you're available to take any questions.
For sure.
Thank you very much for joining us. Again, I'm Steve Hare. I want to thank our sponsors for paying for this nice program. That's Weinstein Beverage. Of course, sitting here in front of me is their new Aquafina sparkling drink. I encourage you to try one. They're really good. Also, Highgate Senior Living is our main sponsor, and we thank them for joining us as well. In the meantime, I'm Steve Hare. We'll be back tomorrow morning with another edition of Wake Up Wenatchee Valley.